You're watching The Wait is Over, Exploring Surgical Weight Loss on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Lancaster County woman finally threw in the towel. She knew something had to be done about her weight. 62-year-old Carol Ann Sahady is on the move. She's in shape and she wants to stay that way. There was a time not so long ago when she wasn't.
I weighed 215 at my highest, and I'm just under 5'3". Stanley, hi honey.
Carol Ann remembers gaining weight when she turned 30.
I wasn't being aware of how much I was eating and how little I was exercising. So I started gaining weight a little bit every year, and it started stacking up.
The pounds really added up during a very sad time in Carol Ann's life.
When my son died at age 22 in '95, and I noticed I started using food for comfort a lot. It was my drug of choice, so to speak. You could be in your home when you're depressed and just sit there and eat a whole container of ice cream, or a whole pie, or a whole batch of cookies when no one's around.
Along with the added weight, Carol Ann developed high cholesterol and sleep apnea. She knew something had to be done. Lap band surgery was her answer.
She came to me and she wanted to have a band put in. And at that time I was doing a lot of bands, so it seemed to me like a perfectly reasonable choice, and that's what we went ahead and did.
I started losing weight. It seemed to be going pretty well. But as time went on, I developed a problem called esophageal dysmotility.
Basically, that means that the swallowing tube is not able to properly propel food into the stomach. It's trying, but it's hitting up against this plastic object.
In the middle of the night, I'd wake up throwing up. And as soon as I told my surgeon that had been happening, she said, "Oh, it has to come out. That's very dangerous."
Carol Ann chose to give weight loss surgery another try, and this time it would be gastric bypass. First, Carol Ann met with psychologist Dr. Andrea Rigby.
I'm involved from the very beginning because patients talk to me about their psychological history, they talk to me about their family history, we're talking about their eating habits, and we're talking about lifestyle issues.
She helps you figure out why you want to have the surgery, what you expect to get out of it, and whether or not you're willing to make the changes.
Carol Ann was willing and ready.
I really wasn't nervous. I don't know why, I just was determined that was the right thing to do, and I prayed about it too. I really felt that I had peace about this decision.
The surgery was not easy. There was a lot of scar tissue in there that was being caused by the band, so we had to work very carefully to get the scar tissue out of the way so we could find the band, get the band out safely, and then go ahead and do the gastric bypass.
The healing process took some time, but Carol Ann stuck to the plan, eat right. Now Carol Ann knows how to control her food intake no matter what she eats, like yummy quesadillas.
My portion sizes are very different. My stomach is a lot smaller, and so I make sure what I eat is healthy. I have lots of fruits and vegetables. I have protein. I have fiber. I have fats. You know, I don't deny myself anything really that I want, as long as I eat in small portions and a variety.
Exercise is a big part of her life too.
I like to run. I've run 5Ks this year, which is a big deal to me. I mean, not that I'm fast, but that I crossed the finish line.
A real winner all around. Carol Ann now wears a size 2 and weighs 130 pounds and couldn't be happier.
I feel younger. I feel a lot younger. Now, I'm not saying I'm going to live forever, but however long I live, I want to be healthy. You know, I just want to be healthy to experience life.
Carol Ann exercises 4 to 5 times a week, and she says she feels great. Chuck?
And she looks great too, Deborah. That's really nice to see that. Now, Dr. Carol Ann was 59 when she had that surgery. Is there an age limit where you don't do this anymore?
Most programs have an upper limit around 65.
Insurances do not list an upper age limit, but we've operated on patients as old as 74. We look at patients over the age of 65 pretty closely to make sure they're going to be able to tolerate the surgery.
Now, patients that have, say, diabetes, high blood pressure, what happens to all that after the surgery? How does that affect that?
This surgery, especially the gastric bypass, is very good at clearing up the medical problems that go along with weight. Somewhere around 60 to 80% of patients will see their diabetes either cured or much improved, and that's true for sleep apnea, high blood pressure, high lipids.
Now, let's say a patient had previous surgery, had a hernia and so on. Does this create a problem with this kind of surgery?
It can make it a little more difficult. I would say about 2/3 of our patients have had previous abdominal surgery, so we frequently have to deal with scar tissue, hernias, and other things like that. We're generally able to work around it and still do a laparoscopic procedure.
Every now and then in a headline you'll see a celebrity that's had bariatric surgery and it gets a lot of headlines, and then you see them later and they regain the weight. How common is that, and how can they avoid that?
Yes, I've seen those celebrities too. Most patients, if they follow up and stick with the program and stick with what they've learned, will maintain their lost weight. It's the patients that stop coming back for follow-up. We're worried about what's going on, and it seems like they may be regaining weight. But if they come back, we can usually help to get them back on track.
Is plastic surgery, is that a factor for patients that lost a lot of weight, maybe some loose skins? How often do they resort to that?
Actually, seldom. It's actually the
Really?
vast minority of our patients that end up having body contouring. Some of them do when it's a health issue, but most patients look pretty good under clothing.
That's it.
Yeah.
Dressing, and also they feel better about themselves. They care of themselves. All right, let's go back to the ABC 27 call center. Deborah?
Thanks, Chuck. Jackie joins us to talk to us about the support group that's available for surgical weight loss patients.
We have an awesome support group with some really exciting events. One of the ones we recently had is called Drop Your Drawers, which was a fashion show for some of our post-op patients. They brought their largest pair of pants from when they weighed the most, and then they dropped their old pants and revealed their new bodies. It was an awesome opportunity for pre-op patients to ask questions of post-op patients, and as well for post-op patients to share secrets, recipes, and some of them even brought produce from their own gardens to share with each other. It's really a great chance to connect, and we want everyone to leave feeling like they're truly supported and part of a community.
Okay, thanks so much, Jackie, and stay with us. We will be right back.
Want to stay up on special events? Learn about new recipes? Just like us on Facebook.